Good evening, ladies and gentlemen. It's 9 o'clock and the Newshour tonight is looking at an issue which concerns each one of you, whichever part of India you're in. We were already told that there was an importance of wearing masks, and there were different kinds of masks that had been told to you every time that you stepped out of home. But today, the top advisory panel of the government, headed by Dr. V.K. Paul, has come out with a new protocol. And this protocol, the man who leads this top panel, V.K. Paul, told the media that it's time that we needed to wear masks even at home. Even when we are inside our homes, we may need to wear our masks. The mutant variety of virus, the fact that it may be airborne, all of this weighing on experts in the medical field, and stating that proximity of in the proximity of the family members also we must wear masks at home. This is the latest advice coming in from the chief advisor to the government in Niti Aayog. Listen in to what Dr. Paul told the media today.
कि अगर घर में एक पॉजिटिव व्यक्ति है तो जैसे अभी दिखाया कि उसको बहुत ज़रूरी है कि वो मास्क पहने, क्योंकि वो फेंक रहा है वायरस बाकियों को। और बल्कि अब मैं कहना चाहूँगा कि सीधा टाइम आ गया कि घर में हम वैसे ही अब मास्क पहनना शुरू करें। हम बाहर की बात करते थे, लेकिन संक्रमण जैसे है ज़्यादा है तो घर में भी बाई चांस किसी को आ गया है तो जहाँ तक हो के घर में भी जब हम किसी के साथ बैठे हैं तो मास्क लगाएं तो फ़ायदा है।
So let's go through this protocol, which is now expanding. We have the latest one of masking up when even at home. We have already been advised to stay at home, isolate ourselves in case we are showing any symptoms or exposed to a positive individual. The government has also advised that you should deny entry to anyone unknown who's roaming around outside to come into your homes if you want to keep yourself protected. We're already staying at home, working from home, and last but not the least, of course, the entire schedule of washing your hands, disinfecting, which should be by now part of your routine. Now, coming back to the latest protocol of wearing masks at home, ever since we flashed this news, viewers have been bombarding us with messages and questions. What's the science behind this new protocol? Will wearing masks 24/7 have a detrimental effect on people? Will we be able to breathe well? Will it suffocate us? Is this the best way to deal with the COVID situation and the crisis that's prevailing in the country? Some are even asking, despite close contact within families, why are some cases coming out to be negative? And even at home, should we be wearing now not one but two masks? All of these questions coming in from our viewers. So ladies and gentlemen, we have an expert panel of doctors and experts joining us on the Newshour, and our citizens' legitimate question to them tonight is wearing mask inside the home a new normal?
The News Hour at 9. Debate number 1. On Times Now. Super Prime Time.
And joining me tonight, Dr. Guleria, Director of the All India Institute of Medical Sciences, Dr. Harsh Mahajan, Founder and Chief Radiologist at the Mahajan Imaging Center, Newshour Debate, Consultant of Infectious Diseases and Secretary General of Organized Medicine Academic Guild, OMAG, joining me on the Newshour tonight. And my first question goes to Dr. Guleria. Dr. Guleria, is this the new normal? Wearing masks at home, is this now the new protocol that is being advised by the government?
So this is something which would help decreasing the number of cases, because I think there are 2 or 3 things we need to understand. The first thing is that the virus has become much more infectious and is spreading rapidly in the community. And we're noticing that when we are seeing people who are becoming positive, it's not only 1 or 2 people, but the entire family which is turning out to be positive. And this is obviously causing a huge strain on the healthcare system. Therefore, I think wherever there is a high number of cases being seen, it would be a good idea if everyone indoor also were to wear a mask. Also, I would add 2 or 3 things, that if you are able to keep yourself in the room that you are in well ventilated, keep your windows open so that if there is any aerosol or droplet infection, it doesn't stay in the air for long and it goes out. At the same time, if you're having a meal together, or if you're having tea together, maintain physical distancing, because at that point in time you will have to take your mask down. So what I think is being said is that it's important for us to break the chain of transmission, not only outside but within the family. And therefore, if you are together, you must wear your mask. If you're alone in your room and there's no one else there, you could definitely keep your mask down, but keep your room well ventilated.
Dr. Guleria, the questions that viewers have been sending us relate to the fact that if we are sitting together, let's say on a dining table, even if we are distant from each other, is this something that can spread the virus? Is this something that can be dangerous? If we are walking around the house and still maintaining distance, should we wear 1 or 2 masks? Because double masks is something that has also been recommended. And if we wear these masks inside the house, will we actually suffocate wearing this all the time, even at home? Questions that viewers are asking. What would you tell them?
So first of all, I think when you're inside the house, you need not really wear an N95 or mask yourself so much, because the chance of infection are relatively less. But at the same time, it's not going to suffocate you. It's not going to cause your carbon dioxide to go up or your oxygen to come down. And I would say when you are in company of others, then it's more important to wear a mask. So if you're all sitting together in a room, then it would be important that everyone wears a mask. If you're all alone in your own room and it's well ventilated, then you should not really consider wearing a mask. Then you are more or less well protected.
Let me get in Dr. Harsh Mahajan. And Dr. Harsh Mahajan, there are a lot of masks that we have been wearing over the last several months. Cloth masks, which many people say are not safe, the surgical masks, the N95, whether to wear 2 of them together, which is the best permutation combination, because there is a lot of fear factor that's doing the rounds in people's mind as we are seeing the COVID infection rate virtually breaking through the ceiling. Can you tell our viewers if this new protocol is something that we should be following because there are mutant variety of the COVID virus? Or is this something that we should generally follow, even if we see, past the peak of the second wave, numbers coming down?
Thank you, Navika. Those are very important questions. And I think if we wear them, we will definitely be better off. And as Dr. Guleria has very rightly pointed out, the mutant strain, which appears to be there, responsible for a significant number of the infections, this is more infectious. What we saw in the first wave, that when someone in the family got infected, maybe 2 out of 6 in the family would get infected. Today, what we are seeing increasingly, that the entire family is getting infected, which leads us to believe that this is a different strain. It is more infectious. Now, as regards the types of masks, we all know. And today, actually, India is in a very good position because of the effort of the government and the private sector in ramping up the production, which used to be 0 in March of last year. And today we are exporting to the world both the PPE kits as well as the masks. Most of us will remember they were very hard to come by. And we were telling during the initial period of the pandemic that the N95 mask is the best mask and that it should be reserved for healthcare workers. That is because it was in great shortage. Luckily today, not only is it freely available, it is also much cheaper, from 250 to 300 rupees, which it cost last year. it is now down to about 25, 30 rupees, which most people should be able to avoid, especially to protect themselves. So the N95 mask, and let me show you one, if you can see this. This is actually the best mask that we have available. Of course, there's an N99 mask, which I won't talk about, but this N95 mask readily available in the market, and enough of it so that even if you buy it, you're not going to deprive a healthcare worker from it. This is 95% efficient in actually stopping the virus from coming in. But that's not the only important point of wearing a mask. The mask has two functions. One, it protects you. Two, it actually stops transmission, reduces transmission, and protects the person opposite you, be it a family member, be it your colleague in office, or be it anyone else. And it may surprise you to know that even a surgical mask is able to reduce transmission by about 90%, whereas this N95 mask reduces it by 95%. And we should, of course, not only should it be a proper mask, it should be worn properly. And I will just show you.
Ask you a question, because this is a question many people have asked. Many people have asked this question. The N95 mask is expensive. Can it be reused? If I wear it today to work, can I reuse it because it's an expensive mask? And second question is, with an N95, do I need a mask below it, a double mask with the N95? What would you like to tell our viewers on that question that's been coming in?
That's a great question. See, the best quality of mask, if you're wearing two masks, has to be worn close to the face. So if I'm going to be wearing an N95 mask with a surgical mask, the N95 mask needs to be worn first, and the surgical mask or a cloth mask will come on top of that, because the most efficient filtration device needs to be as close to me. And also, like I said, it has to be worn properly. It has to fit snugly. And this N95 and many of the surgical masks also have this thing on top, which if you press, it fits snugly. It should fit snugly around the cheek as well as the chin. And the idea is that there should be no escape of air when I'm breathing from the mask. And if I'm going to wear, this is a surgical mask, if I'm going to wear two masks, then this surgical mask needs to be coming on top. And this also should fit snugly. If it is loose, kindly tighten it by shortening the thread on the side so that it fits you tight. And if it is worn separately, as I will show you, then it has to fit snugly. Of course, as you can even see on the television, it is not as efficient because there is some escape of air which is inevitable when you're wearing a surgical mask. But even with a surgical mask worn in the house, as Dr. V.K. Paul today told, will prevent transmission by nearly 90%. So it's very, very efficient at that. And then we have the cloth mask, and the cloth mask also should be a multi-layer cloth mask, even if it is made in the home, it is stitched at home. Try making it at least of 3 layers. And again, if you are to wear a surgical mask,
when you're home, you can wear a cloth or a surgical mask, and that will give you the surgical mask also gives you a 90% protection, not as expensive as the N95. So, Dr. Guleria,
let me just
very right.
complete this point. It protects you about 60 to 70%.
Yes, doctor.
As compared to 95% of an N95 mask and about 50% of a cloth mask. But it's efficient in preventing transmission.
Very, very well said, Dr. Mahajan. But let me come back to you, Dr. Guleria. Dr. Guleria, I want to ask you, N95 mask, is that something that is necessary inside the house, and the reuse issue? And are we seeing the fact that risks have increased, the airborne quality of the mutant virus. Are these reasons that the government is now recommending this new protocol?
So there are multiple factors why the new protocol is being advised. It's an advisory that is basically based, like we were saying, that there is increased transmission that has been observed, and there is a huge spike in the number of cases occurring, and this is happening inside the house also, with a large number of family members getting infected, and therefore this step is trying to decrease that as much as possible. As far as reusing surgical masks is concerned, we have a whole protocol on this, because we've been doing this for more than a year for all our healthcare workers. We issue them about 4 or 5 surgical masks. You use one today, you then put it in an envelope and keep it in a sealed way. You would keep it outside in the sun also, and you use the second one. And you do this for the 4th day, for 4 days, and the one that you use on day 1, you can use again on the 5th day. By that way, you can use these chance of infection. So you can use 4 masks for about 20 days or so by rotating them and keeping them in an envelope outside or sealed for about 4 days. By that time, the chance of the virus being present or causing infection is not there. So there are ways in which you can reuse your N95 mask also. And there are, if you go onto the net or to the AIIMS site, there are very nice videos which have been made telling you how to do that. The other important thing which I would still like to stress is that we know that if this virus is airborne, if it's an aerosol infection, it can stay in a room for a long period, and therefore even people who come into a room and they feel that they are all alone and they therefore will not get infected, can get infected if someone who was infectious was there some time back. Therefore, everyone who is inside, and I'm not only talking of houses, I'm talking of offices also, should wear their mask even if you're inside an office, because you may still be susceptible to the infection. You may feel that I'm alone in the office, or I'm maintaining my physical distancing, now I can keep my mask down, but you are still at a risk, and therefore you must continue to wear your mask even in office, and therefore that is being extended to homes also, and even when you are in any other indoor area. It could be a shopping mall, or it could be somewhere else. Also try and make sure that there is good ventilation. If you are in your office, make sure the windows are open. If you're using a central AC, make sure that air is recycled 4 to 6 times every hour, so that fresh air comes in and the same air is not recycled in again and again, because that could increase the chance of infection. So these are steps which we have to now start taking to prevent the infection spreading rapidly in our community, whether it be our family or it be our colleagues in office. And I think that is why masking up even when you're inside is becoming important.
I want to ask you, the way the second wave has seen infection spreading like wildfire, do you think this has something to do with the fact that we'd actually let our guard down, or do you think the mutant variety of vaccine, the virus was far more infectious than what we saw in the first wave last year?
So if you were to look at it from 2 points of view, I think it's a mixture of both. What happened during the beginning of this year, I would say January, February, we became a little bit more casual because we felt that our cases have really come down. The vaccine rollout has started, and therefore we are in a very good position, and therefore COVID appropriate behavior is not now that important. We can have parties. All the parties which had been postponed were being held there, marriages were being held, and a lot of crowds and functions were being done. At the same time,
or election rallies, or Kumbh Melas,
or election rallies or other things were being done. At the same time, we did not really give the importance that we should have to the variants which are going around in the world. And we knew that these variants were very infectious. They would at some point in time come to our country. We had seen what was happening in the south of England, where there was this huge surge because of the UK variant. And therefore, when these variants came into our country, and we had lowered our guards, this became a sort of an ideal situation for the virus to spread rapidly. And this is exactly what happened. Our spike was so rapid that it really caused a huge strain on the healthcare system. And that is I would say indirectly the price that we're paying today.
Well, one question coming in from a viewer, Ruby Singh Ahuja, asking this question, and Dr. Guleria, I want to ask you, can one wash also the N95 mask and reuse it? Because it's an expensive mask. People want to know whether there is an option of washing and reusing.
N95 masks are not to be washed. Like I said, you can keep them for 4-5 days and then recycle them for at least 3 or 4 times, but they cannot be washed. You can wash your cloth mask. The surgical mask also cannot be washed.
All right. So, there are two questions that many people have raised. And first, let me ask Dr. Mahajan this. Dr. Mahajan, you also run a testing center. Of late, people have been waiting long, and I know the queues are going on. But many in the same house, in close proximity, get themselves tested, but get what is called a false negative. And doctors are still treating those people with the same protocol as for the COVID treatment. Why are these false negatives coming up? Is it because many people say this, and this is a conspiracy theory, that politicians, don't want their states to show up numbers more than what, there's some sort of a competition. So above a certain load, declare everybody positive. Below that, declare everybody negative. Is there any tweaking of these test protocols and these false negatives that come in?
Let me tell you very clearly, Navika, there's nothing of the sort. There's no tweaking that is possible. There is no tweaking that you can do. It's the ICMR protocol that is followed. If your CT score is 35 or below, then you're positive. If it's above 35, then you're negative. This is what is more or less used globally, and this is the ICMR recommendation followed by all labs, both public and private across the country. Now, coming to your point about one person or 2 persons in a family testing positive, the others testing negative, there can be a scientific explanation of this. It may be that one person actually gets infected first, comes into the house, and it may take a day or 2 before the others catch the infection. And one of them is symptomatic. Everyone goes and tests. The symptomatic person definitely will come positive. Maybe another person comes positive as well, who may be asymptomatic, whereas 2 other people in the family come negative. But that is only because the incubation period of this viral disease varies from 2 to 14 days with an average of 5 days. So if we were to repeat the RT-PCR 2 or 3 days down the line for these other 2, it may come positive, or if they are lucky, if they were wearing masks, if they didn't come close to each other.
So no conspiracy theory here, viewers. It is as per the ICMR protocol, that testing center. Okay, no conspiracy working there. Before I let you go, Dr. Guleria, just one last question that I'm getting from my viewers, and which is, when do you expect the peak of the current second wave, after which you expect numbers to taper off and give some sort of relief, not just to the health warriors, but also to people who are virtually living in fear these days?
So I think I'll just add on to what Dr. Harsh Mahajan said, that we must understand every test has its sensitivity and specificity. And the RT-PCR test has a sensitivity of around 80%. That is that you may still miss 20% of people who are having COVID, and therefore the test is not a 100% sensitive test. It is very specific. And therefore it's important to remember that sometimes you have to look at the clinical profile, the logical profile, and make a diagnosis even if your RT-PCR test is negative. Regarding the tough question as to when will we see this peak coming down, I think a lot will depend on how we behave. If we are able to have COVID-appropriate behavior, if we are able to prevent crowds, if we are able to break the chain of transmission, this is a human-to-human virus. This virus spreads from human to human. And if all of us were to mask up, if all of us were to maintain distance, and the virus was not able to spread, I'm sure within the next few weeks we would be able to bring it down. But if we continue to have crowds, if we continue to have big functions, then the virus will continue to spread and spread to various areas, including the hinterland, where still a large number of our population is susceptible. So a lot depends on how we behave in the next few weeks if we need to bring this peak down and bring down the strain on the healthcare workers.
Well, thank you very much to all of you three doctors, and ladies and gentlemen, the onus is on us. So we wear our masks at home. We wear masks simply because some people who may be infected even at home may be absolutely asymptomatic, which is why if you are together with people, even from your own family, mask up. The N95 mask, expensive but can be reused after 4 days, and the entire explanation being done by Dr. Guleria and Dr. Harsh Mahajan, and of course masking up, keeping our washing of hands and sanitizing our environment, and not stepping out or meeting people on close quarters. All of these are steps that we will need to take, and we're not going to suffocate. That's the big message coming in from the doctors. Wear your mask, you won't suffocate, and now wear them at home as well, because that's what is required to break the chain. Thank you very much, Dr. Guleria, Dr. Mahajan and Dr. Gilada, for joining me on the Newshour tonight. We'll take a short break, and Janta Mange Jawab. All that coming up on the other side.